Hello and welcome. Today we're shedding light on a less common but important digestive disease, small intestine cancer. This video will explore what this cancer is, its causes, symptoms, diagnosis, treatment, and more. Let's delve into the intricacies of this condition to gain a better understanding. The precise causes of small intestine cancer are not fully understood, but several factors are known to increase the risk. These include genetic predispositions, such as familial adenomatous polyposis, Lynch syndrome, and Peutz-Jeghers syndrome. Certain pre-existing conditions like Crohn's disease and celiac disease, especially if poorly managed, can also elevate the risk. Dietary factors, like a diet high in red meat and low in fiber, have been implicated, as have environmental exposures to certain chemicals. Keep in mind, however, that many people with these risk factors never develop small intestine cancer, and some people with the disease have no known risk factors. The pathophysiology of small intestine cancer involves uncontrolled growth and division of cells within the lining of the small intestine. These abnormal cells can form tumors that disrupt normal digestive processes. As the tumor grows, it can invade surrounding tissues and organs, such as the pancreas, liver, and large intestine. Cancer cells can also spread to distant sites in the body through the bloodstream or lymphatic system, a process called metastasis. This spread can lead to the formation of secondary tumors in other organs, making the cancer more difficult to treat. The specific location of the tumor within the small intestine, its size, and whether it has metastasized all significantly impact the patient's prognosis. Small intestine cancer is relatively rare, accounting for less than 5% of all gastrointestinal cancers. It's more frequently diagnosed in older adults, typically those over the age of 60. While the exact incidence varies across different populations, it's generally more common in developed countries. Certain genetic conditions, as mentioned earlier, increase the risk and can skew the distribution, affecting individuals at younger ages in families with these predispositions. It's crucial to remember that while rare, awareness and early detection are vital for better outcomes. The signs and symptoms of small intestine cancer can be vague and non-specific, often leading to delayed diagnosis. Common symptoms include abdominal pain, which can be persistent or intermittent. Unexplained weight loss, fatigue, and weakness are also frequently reported. Changes in bowel habits, such as diarrhea or constipation, or blood in the stool, can indicate a problem. Some individuals may experience nausea and vomiting. In advanced stages, jaundice, a yellowing of the skin and eyes, may occur, because these symptoms can be caused by a variety of other conditions. It's essential to consult a doctor if you experience any persistent or concerning changes in your health. Diagnosing small intestine cancer can be challenging due to its location deep within the abdomen. Several diagnostic tools are used. An upper endoscopy, also called an esophagogastroduodenoscopy, or EGD, allows the doctor to view the upper portion of the small intestine. A colonoscopy can examine the lower portion. Capsule endoscopy involves swallowing a small, disposable camera that takes pictures as it travels through the small intestine. Imaging techniques, such as CT scans, MRI scans, and PT scans, can help visualize the tumor and determine if it has spread. A biopsy, where a tissue sample is taken for microscopic examination, is necessary to confirm the diagnosis and determine the type of cancer. Sometimes a double balloon enteroscopy is needed, which uses a longer scope with two balloons to navigate and visualize the entire small intestine. Small intestine cancers are classified based on the type of cells they originate from. Adenocarcinomas are the most common type, arising from the gland cells in the intestinal lining. Sarcomas, which develop from connective tissue, are less frequent. Carcinoid tumors, which originate from neuroendocrine cells, are also found in the small intestine. Lymphomas, cancers of the lymphatic system, can sometimes affect the small intestine as well. Each type of cancer has different characteristics and may respond differently to treatment. Treatment for small intestine cancer depends on several factors, including the type and stage of the cancer, as well as the patient's overall health. Surgery is often the primary treatment, aiming to remove the tumor and any affected surrounding tissue. Chemotherapy, using drugs to kill cancer cells, may be used before or after surgery or as the primary treatment if surgery isn't possible. Radiation therapy uses high-energy beams to target and destroy cancer cells. Targeted therapies, which attack specific molecules involved in cancer growth, may be used in certain cases. Immunotherapy, which boosts the body's immune system to fight cancer, is showing promise for some types of small intestine cancer. A multidisciplinary approach involving surgeons, oncologists, and other specialists is crucial for optimal management. While it's impossible to completely eliminate the risk of developing small intestine cancer, there are steps you can take to potentially reduce your risk. Maintaining a healthy lifestyle, including a balanced diet rich in fruits, vegetables, and whole grains and low in red and processed meats is recommended. Regular exercise and maintaining a healthy weight are also important. If you have pre-existing conditions, such as Crohn's disease or celiac disease, it's essential to manage them effectively under the guidance of a healthcare professional. If you have a family history of genetic syndromes associated with increased risk, genetic counseling and screening may be beneficial. The prognosis for small intestine cancer varies depending on the stage at diagnosis. Early detection and treatment lead to better outcomes. The 5-year survival rate for localized small intestine cancer is significantly higher than for cancer that has spread to distant sites. Recent research is focusing on developing new targeted therapies and immunotherapies to improve treatment outcomes. Studies are also exploring ways to identify individuals at high risk for small intestine cancer to enable earlier detection and intervention. The field is constantly evolving, offering hope for improved outcomes for those affected by this disease.